I think that ultra-processed foods are the most important nutrition concept to come along since vitamins. And I say this because I talk about this from a public health standpoint. I'm interested in public health. Obesity and overweight are the most important public health nutrition problem in America today. The CDC says that 74% of American adults are overweight or obese, and 40% meeting the criteria for obesity. And we need to look at what that's about. And one of the things it's about is eating more calories. Obesity rates started to increase in 1980, and between 1980 and 2000, the number of calories in the food supply increased by nearly 1,000. It went from about 3,000 calories to 4,000 calories a day, and people began eating more calories. And we need to look at why. And part of the reason for that was that corporations had to respond to the shareholder value movement, which was a movement that required corporations to make returns to stockholders their very first priority. The food industry got hit hard by that because of the 4,000 calorie a day problem. It's hard to sell food in that kind of environment. So food companies began making new products that were irresistible, delicious, inexpensive to produce, and extremely profitable. What's important to understand about ultra-processed foods is that they are a very specific category of foods. And this specific category by now has been associated in at least 1,000 experiments. Since 2009, when the concept was developed, at least 1,000 experiments, some of them very well done, some of them systematic reviews and meta-analyses, have demonstrated a very close association of consumption of ultra-processed foods with obesity, which, as we know, is a risk factor for type 2 diabetes, coronary heart disease, morbidity, mortality, and these days, COVID-19. So a major public health priority is to reduce intake of ultra-processed foods, not eliminate them entirely, but reduce them. This is a challenge to the food industry, and I recognize that it is. But I realize that you're not a public health agency, but you need to take this concept seriously. We need to reduce intake of ultra-processed foods. Thank you.